and it is time that we speak up and educate teens and young adults about mental illnesses that can appear later in life. We need to educate teens and young adults so we can prevent risks of suicide and substance abuse disorders. There are many mental illnesses that can appear later in life. For example, schizophrenia. Schizophrenia is a personality disorder that can appear between 18 years old and 26 years old in life. Symptoms of schizophrenia disorder would include delusions, hallucinations, abnormal motor behavior, and disorganized thinking. People can carry a mental disorder within their whole lives, but it can be triggered by environmental changes, traumatic life events, or being under great deals of pressure. I'll give you guys an example. An 18-year-old boy has been accepted to college in a different state. So now he has to move across the country. He's going to be experiencing all new environmental surroundings. He will also have to help pay his parents tuition, so he's going to have to start working at a hardware store. And on top of all that, he's going to have to maintain his grades. Being under such great deals of pressure and a whole new environmental changes, his schizophrenia has been triggered. He is now having delusions that his professors and his roommates are out to get him. And as he's trying to go to sleep at night, he's having hallucinations that his roommate is telling him that he will never amount to anything. He is completely devastated and cannot express or comprehend what is happening to him. He has grown up hearing about schizophrenia maybe once or twice in his life, but he has never been properly educated upon it. He is now terrified to speak up because he doesn't want to be labeled as crazy. And he is now at risk for suicide and a substance abuse disorder. Approximately 5% of people with schizophrenia is at 5% risk for suicide within their whole lives. There are many other mental disorders that can appear later on in life, such as schizoaffective disorder, bipolar disorders, and major depressive disorders. Schizoaffective disorder is very similar to schizophrenia, but it is a mood disorder in addition to a personality disorder. People with schizoaffective disorder and schizophrenia disorder are at high risk of suicide, especially when episodes of major depressive. Sometimes suicide risk can be an example of a command to a hallucination or a delusion to hurt oneself or another. In addition to schizoaffective disorder, bipolar disorder, onset of bipolar disorder is about 18 years old and can go all the way up until 26 years old. People with bipolar disorder cannot comprehend their moods like normal people. Normal people experiencing moods of anger and sadness just like this. Well, people with bipolar disorder can be in manic episodes for about 3 days to a week and then shoot down to depressive episodes for about 3 days to a week. About 15% of the world's population has bipolar disorder. They also, bipolar disorder is about 1/4 of all suicide attempts, and they have a higher risk for suicide ideation. In addition to bipolar disorder, major depressive disorder can happen at any age, but the risk is greater within puberty and all the way up until your 20s. So how can we fix this? We can send speakers to educate students in high schools, to talk to kids and young adults about symptoms and what they can do if they start experiencing symptoms. We need to let them know that it is okay and they can speak up if they are experiencing symptoms. Not every child will get a mental disorder, but they might know somebody who will have one and they can help them. It is up to us to educate kids and young adults to prevent suicide risk and substance abuse disorders. Thank you.